Good afternoon, everybody, and welcome to the second annual Real Challenge lecture. Aficionados will know that the Real Centre was set up by the Health Foundation as a kind of OBR for health and social care, doing long-range projections on the resources that the NHS and social care system will need into the future based on the best available supply and demand modelling. But as well as fancy quant, the Real Centre also convenes an annual lecture to challenge our thinking. Last year, it was on the historic patterns of spend on the NHS and why it was so irrationally lumpy. And that lecture was given by Sir Andrew Dilnot, who is here with us today. But this year, the subject is social care, not about the funds it needs or indeed how the cap will work, but the very nature of care. The title is A Radical New Vision for Social Care, and I'm absolutely thrilled to say it will be delivered by Dr. Hilary Cottam. Hilary is a well-known social entrepreneur who is working with communities and governments across the world to develop and design affordable solutions to big welfare challenges. Her book, Radical Help, was received with widespread acclaim, and her associated TED Talk has been downloaded and viewed more than 250,000 times. She was awarded an OBE in 2019 for services to the welfare state. So what we're going to be doing at today's lecture is that Hilary is going to give her lecture in about 30 minutes, and then we'll join a panel discussion that will be chaired by Andrew Dilnot. Andrew probably needs no introduction, but among many other things, as you know, he's not only an expert in the funding of social care, but he's also warden of Nuffield College, Oxford, and also he is the chair of the Expert Advisory Committee for the Real Centre, which is giving this lecture today. So just some housekeeping notes just for us to start off before I give way to Hilary. So you as a virtual audience will no doubt be a very thoughtful bunch. So please ask your questions throughout the lecture, and what we'll try and do is pick up some of those in the discussion afterwards, chaired by Andrew. For the Twitterati, please use hashtag RealChallenge for the Twitter handle. And also to say that Hilary's lecture is if you want the paper version, it looks like this, but it's also on our website, then you can download it. And also to say that the recording of today's lecture will be available in the next 24 hours, so do tell your friends. So with all of that, I am now going to be handing over to Hilary to give her lecture entitled A Radical New Vision for Social Care. I'm absolutely delighted to invite Hilary to the podium. Thank you, Hilary.
Thank you. So I've just been mic'd up. Can you hear me? Yeah, okay, brilliant, thank you. So thank you, Jennifer. I am very honoured to be giving this year's lecture with the audience here and all of you, many of you online, and my esteemed panellists that will join us later. And before beginning, I particularly wanted to thank you, Anita Charlesworth, the director of the Real Centre, for offering me this invitation this year, and also for the help that you and your fantastic team have given me in the preparation of this lecture, particularly in the data and the support that's in the full version of this lecture. Quite early on in the pandemic, the journalist Sirin Kale went to meet the vaccine makers, and she found collaborative teams working long hours in a race against time. And there were early breakthroughs, and she asked them, "What's the secret of your success?" And obviously she expected a scientific answer, but this wasn't the response she got. "Our husbands, our families, our networks," her interviewees responded. "You can't make a vaccine without someone cooking your dinner, doing your laundry, looking after your children." As these dedicated modern scientists saw it, care had made the vaccine. Stories of care have been the steady baseline beat of this COVID pandemic. And in the beginning, of course, our spirits were really raised by spontaneous acts of community care. And at the same time, there was this more alarming thrum of crisis that came from our care homes, the realisation that so many were dying, that care homes had been abandoned, required to tend infected, vulnerable older people without the requisite resources and protection. Tragically, many care workers themselves became vectors of contagion. because even when they were unwell, they felt they had to keep on working. They didn't have benefits, they were on low pay, and they had no other option if their families were to eat. As schools closed, millions more families found their lives hanging from increasingly precarious threads. The She Session, the dent to women's work as nurseries closed and homeschooling increasingly fell to mothers, has made the headlines. Schools were a form of care that allowed us to work. But they're also the places where vulnerable children were cared for, through the provision of school meals, the presence of trusted adults, and much needed friendship. The pandemic, we all know, has exposed this very deep crisis in care. Despite decades of brilliant work, research, policy papers, advocacy, and the data, we are stuck. So today I'm asking, how could things be different? How could we tell a new story about the ways in which care would enable all of us to flourish? A story that can ignite imaginations and through that move us towards actual action. Can we care about care? In 2017, in a surprise TED Talk watched by 3.5 million people, Pope Francis addressed the ways in which our futures are deeply connected and dependent on one another. I become an I through a you, he declared. And his words echoed the writings of the German philosopher Martin Buber, whose 1920s treatise, I and Thou, describes the way that we become human through our relationships with and our care for one another and the natural world around us. So just as we now know that trees stand tall in their individual beauty by entwining their roots with one another, so we as individuals, communities and nations are only able to reach our full potential within ecosystems of care and support. This idea that the work of caring for one another is core to our humanity and human well-being was really well understood by our ancestors. But gradually, in the West, this understanding of human flourishing has unravelled. Our implicit understanding of human thriving as a collective endeavour in which caring and our need to draw on support plays a central role was replaced by a utilitarian model, which I think is best characterised by that rapscallion Homo economicus. So you know him, he's the individual who realises himself through a ruthless quest to maximise individual material gain. Caring in this utilitarian model is placed elsewhere, it's out of sight, it's outsourced. If we could find a way for others to take on this messy business, this logic tells us, then that's the route to well-being. So there were really good reasons for this shift, not least the realisation that the work of care, which I'm defining as everything we do to maintain, continue and repair our world, our bodies, ourselves and our environment, was increasingly falling. It wasn't shared, it was increasingly racialised, feminised and falling on women. Women within the household, and again on women, and particularly women of colour, within institutionalised welfare systems. Care work, these women remind us, can be joyful and fulfilling, but it's often repetitive, tedious, and rarely valued in monetary or any other form. A world in which caring is neither shared nor valued oppresses. It doesn't make either the carer or the cared for feel valued, and it doesn't enable us to flourish. But today I think we see a hunger to reimagine these tensions and to think again. Growing numbers of us want to put care for each other and the environment before money. Attachment economics, restoration economics, the foundational economy, the work of the Women's Budget Group, all this thinking and more represents a really growing inquiry into how we might reorder our economies. I think in different ways, all these groups and inspirational thinkers are seeking to heal the current split in consciousness, where we're asked in myriad ways, explicit and implicit, to contribute to the economies of extraction in the hope that invisible others will do the work of repair and care on which we all depend. Today we face a binary world, which falsely assumes that work and care are mutually exclusive spheres. Millions of us, I'm sure many of us here today, live lives of acute stress as we try to manage this border war, the competing demands of caring for small children, friends who perhaps need some extra support, for young adults whose minds and bodies are deemed in some way not to fit, or for our beloved parents. Before the pandemic struck, I was conducting workshops across Britain with people from all walks of life: nurses, carers, grave diggers, nuclear weapon makers, university professors, and many more. And in these workshops, everybody cited what they call the juggle as the single biggest challenge in living good lives. Everyone wanted to rethink the linear working life, and they wanted to rethink this in often quite profound ways that would allow work to be rewoven with time for connecting, learning, and caring. Of course, these demands aren't new. We stand on the shoulders of decades of feminist scholarship, the activism of disability and carer movements, and more recently, environmentalists who really understand the ethical connections between care for ourselves and care for wider living webs. But what I'm asking is, might this moment in which the forces of a technology revolution, which is really disrupting our work, a looming environmental catastrophe which has to reorder what work counts, and the cruel effects of the pandemic which have so cruelly exposed the fault lines in our existing care systems, might it offer us a real chance to reimagine and reorganise? So I originally studied history. In fact, one of my fellow historians is here today. And I have this very deep interest in the relationship between technology revolutions and social change. The relationship isn't linear. The social gains that have previously accompanied shifts in technology, better health, longer lives, better working conditions, have been very hard won. And we've seen that they're not irreversible. But the longer run trends are clear. New technology disrupts and creates opportunities for radical social change. If you told all those people who crowded into our cities at the beginning of the last technology revolution, the industrial revolution of mass production, that they would gain decent incomes, paid holiday and a 2-day weekend, you'd have been roundly mocked. But it happened. And I want to suggest that the weekend, that totemic gain of the 20th century, should be echoed in this century in a rethinking of the relationship between work and care. Care time should become as normal as the weekend. So some, perhaps like their early 20th century counterparts, believe this kind of change sounds utopian, but the lessons from history and modern day experiments tell us otherwise. Weaving care and work together enables higher productivity and greater life satisfaction. And it might also enable us to repair the fragile ecosystems on which our human life ultimately depends. So I want to give you just 2 examples. The first is from the 1930s, when Kellogg's, the biggest manufacturer of breakfast cereals in the world, started a radical experiment of 6-hour working days for the same pay. And workers at Kellogg's loved this change, these shorter working days. But what's interesting is they also didn't think it was particularly revolutionary. In the 1930s, people assumed that technology would deliver liberation as the norm. And Keynes had recently written this treatise predicting the 15-hour week. What detailed economic and household studies of the Kellogg's experience show are 2 things. So firstly, workers use their time in lots of different ways, but they all recorded their increased health and happiness from having the time for what they broadly called maintenance, which was taking care of children, making things from culture to good things to eat, joining clubs, and just having time to pass together. Secondly, Kellogg's productivity and profitability rose. Actually, people from all kinds of businesses flocked there to see what was going on at the time, and the government sent investigators and so on. Because even though workers were earning the same wage for less hours, profitability and productivity was going up. Cared for and happy workers were better workers. And so not only did output rise, but industrial accidents fell dramatically. And I think this evidence wouldn't surprise modern day experimenters such as Karen Mattison and Emma Stewart, who are the founders of TimeWise. So TimeWise is a consultancy built on a simple premise, which is that if you offer good, part-time, flexible work, you'll attract a talented, loyal, and highly motivated workforce. It's not surprising that in the beginning, many of the people who went to TimeWise were mothers seeking new ways to balance the care of their very small children with the professions that they loved. But TimeWise grew because actually employers realised that they were attracting much higher calibre candidates through offering predictable but flexible work, time to care. And TimeWise are pioneers because they've shown over almost 2 decades now that work and care can be reintegrated so that life and business is better. The common thread running through the reorganisation of Kellogg's, the innovations at TimeWise, the words of the Pope and the interventions of activists is a recovery and reconceptualisation of what it is to be human and to flourish. Our systems, social and economic, are designed around who we imagine humans are. And today, that imagined human is the solitary, calculating and insatiable Homo economicus. So to create change, we have to explicitly recognise that scholarship from the widest range of disciplines is telling us that humans are not, in fact, wired in this rational and individualistic way. This human template no longer fits, and we have to consciously replace it to design systems in a different way. We become who we are in relationship to others. We grow, we suffer, we learn for pleasure, and above all, we connect. Anne-Marie Slaughter, who's here with us today, and I, call this new human sapiens integra, and they are the template around whom we have to design our new systems. So I'm arguing that at a very profound level, human well-being is not about the design of a great social care system that just patches up the gaps where real life should be. It's about turning this thinking completely on its head and inverting it. We have to think first about how do we create the conditions for good lives, which means the ability to support and care for one another across the lifespan. And this work is messy, as I've said, it's often pleasurable, and it has to be shared. Care is a continuum. We need everyday time that allows each of us to contribute, and we need the expert work of professionals, of course, but working within redesigned support systems. And this redesign doesn't start with the current system. It starts with a very different understanding of the role that care plays within human and natural world systems. And this in turn then, of course, provides very different principles that can guide and govern the creation of new systems. In nature, the new is frequently born through cataclysm, the flood, the forest fire, the ravages wreaked by a storm. And perhaps in a similar way, we can use this current conjuncture. We could free our imaginations for just a moment by imagining the death of an institution that exemplifies the impossible boundaries we've placed between everyday human care and the service that goes by the same name. An institution that in this pandemic has been the site of so much grief and death, the care home. The story of a friend of mine might be familiar to you. Just before the pandemic made such things impossible, she visited her mother, who is frail and elderly and lives in a home where she has to be bathed and dressed and fed by others. And my friend, when she goes, no longer recognises the wisp of a figure her mother has become. And her mother, in turn, has forgotten who her daughter is. And of course, this situation is a source of anguish for my friend, I'm going to call her Mary, who, despite the fact that she won't be recognised, makes the long trip from London to the northeast on a regular basis, full of love for her mother. On one particular visit, Mary found that her mother was distressed and in considerable pain, and it seemed that a tooth had broken. And so because she couldn't get a proper look, she asked the doctor on duty whether perhaps an anaesthetic could be arranged in order that the problem could be looked at without causing her mother distress and more pain, and then it could be addressed. Oh no, the doctor said. The anaesthetic might be general, would have to be general, and it might kill her. The care home is a place fraught with these complex emotions and contradictions. I think few of us can really bear to think about the frailty that is inherent in being human, and hardly anyone wants to live in an institution. Our apprehension that we might be moved from a home to a home isn't only a fear of death, which of course is the only exit. It's a fear of loss, the disruption of the natural rhythms of life, being dressed in someone else's cardigan, eating things you don't like, sitting next to people that don't interest you, and losing your memory and your mind. Of course, care homes for the elderly are only one part of our industrial care system, and it surprises many people to learn how few of us will actually reside in such places, and surprises even more of us to learn that the greatest growth in care need in recent years hasn't been amongst the elderly, but rather among young adults, and amongst the 15 million of us who suffer from chronic health conditions that require active care as opposed to the medicine on offer. But I think the care home perfectly symbolises the care system we know today. It's a node in a form of warehousing that is euphemistically called care and is on offer for everyone, not just for older people. Childcare is another point in this failing system, and it's also organised according to the same industrial logic. And this logic tries to lower the unit costs in order to increase the scale of production. So the answer is low wages for carers, and as many little children as possible allocated to each carer. And against the advice of childcare experts, up to 8 preschool children can be left with 1 adult carer in Britain. Policymakers assure us, don't worry, the carers are increasingly well trained. But no adult, however well qualified, can take 8 very small children on a walk, or make something with so many tiny hands at once. The activities that are core to our human development are curtailed. For older people and for adults who are cared for within their own homes, the care on offer isn't very different. You just find yourself at a different point in the industrial conveyor belt. This is the system that offers a young person a befriending service rather than trying to find ways to connect them to the friends that they already have. It's the system that confuses the practical support adults need in their lives, perhaps a PA, with paternal ideas about what care provision is. And it's the system that leaves notes by the door, reminding the visiting carer, who'll rarely be the same person and will have a 15-minute slot, that the white flannel is for the face and the blue flannel is for the bottom. Care today isn't defined by the warmth of human connection or the practicalities of support needed, but by this uneasy relationship between the marketplace and transactional state regulations. The care home is a place where fortunes are made. It's well documented that children's homes and old people's homes in Britain are centres of profit. Physical assets are wrapped into complex financing structures where taxes can be avoided and immense wealth is made when the time is right and the assets are flipped and sold on. Unsurprisingly, given the mismatch between human need and the state market structures, few can bear to work very long in these conditions. In her moving and magisterial study of the crisis of care, Labours of Love, written by Madeline Bunting, if you haven't read it, I really recommend it, she writes of her visits to a care home that's well run. And in the end, she can't bear to go back to the home. And she writes, "I had retreated, overwhelmed by the sheer scale of human need bursting out of that neat building." I've written before of the choice faced by many thousands of health workers, social workers and care workers between burnout and numb out. I've worked shadow shifts in a whole range of care institutions, and there's a very large gap between the personal care plans that are routinely referred to by my colleagues and the reality of the person sitting waiting to be moved, fed, medicated. And Madeline Bunting describes the distant bland competence used by the staff with varying degrees of cheerfulness. She describes this lack of humanity as a way of coping. Of course, the alternative is to leave, and the care sector has very high turnover rates and currently well over 100,000 vacancies. And Kelly is one of those carers who can't bear to stay. She says, "My shift was 7 a.m. to 3 p.m, but I would sometimes work until 8 p.m. because I was always behind. Later, I discovered that my insurance stopped at 3 p.m, and after that, it was all at my own risk." Kelly is subsumed by worry that she hasn't done a good job and her pain at leaving people who pleaded with her just to stay 5 more minutes. She lost weight, she took the worries home, and she stopped sleeping. And after 18 months, she has to resign. And she explains to her manager that this is not care. And he explains to her that this is what social services can afford. In his 2019 film, Sorry We Missed You, the filmmaker Ken Loach shows the impact of this form of industrial care work on the care worker's home and family life, the costly social spillovers that undermine us. Abby, who's a carer, loves her work, and we see her very kind and mindful care for those that she's in charge of. We live her long shifts, and we see how the combined low pay and long hours of her and her husband's work, Ricky, her husband, is a delivery van driver, makes it impossible to juggle caring for their own children. Supervising homework, noticing when the electric meters run out, doing the laundry, saving some money, doing the myriad small things that are required to maintain family life are out of reach for the care worker. We watch as in debt and exhausted, Abby's once loving home life comes apart in the face of impossible odds. Abby's miserably low wages contribute to the profits of the private care provider, but they also create costs elsewhere. The untold personal cost of an unravelling marriage, the significant financial costs to the state through the need for police intervention, court appearances of her son, the need for school intervention, a truancy service, huge demand for mental health support, and so on. Too often when we talk about redesigning care, the conversation is about redesigning pathways into and out of these systems. And we also talk about how these systems could be better funded. But the reality is we need to talk about the stuff of care itself, and we need to unpick and reweave our systems in very new ways. But this is very hard. It requires new stories, new ways of seeing and working, and new forms of data and accounting. The work and the methods of the French philosopher and historian Michel Foucault provide us with one example of a different way of seeing. In the middle of the last century, Foucault embarked on a unique study of institutions. And invoking the death of the care home, I'm echoing and inverting one of the most famous of these studies, which he called The Birth of the Clinic. The Birth of the Clinic is a study of the transformation of a system, a moment in history when disease, which used to be something that was taken care of at home, moves into the new medical space of the clinic. And the clinic, once established, becomes associated with certain rules and practices, and power is vested in the medical profession, who have new systems of observation and classification, which create this almost abstract science that is no longer about the individual human or their wider social context. The contemporary development of statistics at the same time that the clinic was born played a particularly important role in this new culture and practice. And I think it's not hard to see the parallels between the clinic and the care home. There's a focus on the body rather than the whole social being, a binary shift from being one only the family to being only the institution, a sanctity of the professionals, who are the ones who know, the reliance on data and indicators, which officially tell us what's happening, but actually occlude, they tell us whether the home is clean and the residents are well cared for, but they actually hide most of what we want to know, which is how are people feeling, what's the quality of human interaction, what's the balance in power between those who need support and those paid to offer support. And Foucault likened his historical methods to archaeology. And in trying to uncover how institutions come into being, he was making visible the way that certain institutions come to order society in ways that are so deep-rooted that they become perceived as a sort of common sense that we can't change. The procedures and ways of operating of these institutions, the clinic, the prison, and I think also the care home, are tightly regulated, but the premises are seldom questioned. Actually, Foucault's studies show that these institutions are rarely reformed, even when they've clearly failed. Instead, the impulse is to reinvoke or redesign the original, such is the strength of the wider systems of data, regulation, and professionalism that these institutions hold in place. So again, I think we can see here the parallels with the care system and the way in which, again and again, plans for deep reform are regularly stalled, ignored, or watered down. We can also see the abstraction to which Foucault refers in the striking way in which care debates today are largely conducted without reference to the wider social context. The increasing poverty and widening social inequalities that impact on children's care in particular, I think, are important here. Children in Britain's poorest neighbourhoods are 10 times more likely to be taken into care in comparison with their affluent peers. But this correlation between poverty and being in care isn't central to any of the current plans or reviews into system reform, which continue to emphasise the regulation and practice of the system as if it operates in a social vacuum. I'm using this comparison because I want to illuminate the way things within the care system that we currently see and treat as disparate, research, data, working conditions, our understanding of risk, of cost, of regulation, even the language of care, are part of a connected way of thinking and operating that can't serve us any longer. By invoking the death of the care home, I'm not necessarily suggesting that we don't need homes, but I'm asking a bigger question about how we might free ourselves from the concepts that don't serve us and think again and flourish. And I'm also situating our need to redesign and reimagine within a particular historical context, because we've inherited an industrial system of care. And in this century, which is a new technological era, we face new challenges and we have new possibilities, and it is possible to create something new. So how could we make it happen? In closing, I just want to talk about 5 aspects that I think we could work on now. And each of these is actually largely a silence in the debates we have at the moment, but I think it's a foundation stone for making any real change. And the first is about the group I call the Imagineers. It's those with the experience of caring, of being cared for, who have the ideas, the stories, the imagination to help us think again. And when I talk about the Imagineers, I'm not talking about how we should do focus groups or have consultation or just have, obviously, the critical representation of lived experience. It's not about people who have the power deciding much later how to bring people into their design processes. It's about shifting the frame and starting from the perspective of those who are knee-high or who at a particular moment in time need extra support, or people like Kelly who've suffered from working in the existing systems and have ideas about how it could be different. We have to start with these everyday stories, which we then can't try to flatten. We can't try and pull them into our terms of reference. We have to see them in their own terms of reference. Secondly, the carers. Madeline Bunting describes the word carer as a reductionist description of a relationship developed to suit the bureaucratic need rather than lived experience. 1 in 10 of us have some form of caring role, and we want to see it reinvented in the everyday. Millions of us want to have the possibility of caring when we want to, but this can only happen if we rethink work. And this isn't enough. Carers, although they might not be called that, have to be to this technology revolution what engineers were to the last. The work of this century is work of repair, of ourselves and of our wider environments. And if we're to make the transition to the restorative green economy that will ensure humanity's future and that so many of us long for, then the work of care and maintenance of each other and these wider webs of life that we're part of has to be a core and respected activity. We have to design this role in the way that thousands embrace the work, not because they have to, but because they want to, because it provides us with a good income, time for a good life, because it's honoured. And this means moving from data that tells us about the cost of care, old accounting, to looking at how we can think about investment, new accounting, how we can create paths from old dirty work, in inverted commas, in the old industries to new clean jobs in care. And this means we have to redefine the nature of the work. Which leads me to my third point about craft. Because care is an art, it's a craft, it's a relationship, it's about entangling ourselves in the lives and emotions of others. Care isn't an activity that can happen by the clock, the kind of slots that undo Kelly and Abby and so many more brilliant professionals that I've worked alongside. Care belongs in the world of kairos time, which is measured by flow and connection, as opposed to chronos time, the industrial time, measured by minutes and deadlines. Care is an ongoing human activity. And in the written version of the lecture, I talk about a participative design experiment I started over 10 years ago called Circle, working in communities with those aged 60 and over. And over 10,000 people joined this experiment and helped create it, and taught us that we needed to value what was provided, whether it was kind of social activities or help in the home, by the relationship, not by the time. And we developed new forms of accounting and budgeting and metrics that showed how this could happen at some scale. So this is really possible. But it requires these new forms of institution, which is my fourth point. As the proverb rightly goes, new wine cannot be made in old bottles. Old bottles and wine are damaged. So we have to reimagine the institutions that together constitute 21st century infrastructure of care. This includes the spaces we play, generous housing that can allow different generations to be together, park benches, things like public toilets that allow older people to go out. All of this makes it possible for us to connect and live together. It takes care of us. And this infrastructure, of course, also includes professional support, expert childcare, personal assistance for adults, support when our families are in trouble, and for older adults and in later life. But what we imagine here is not a sibling system of the NHS, a national standardised set of institutions. It's about a web of support, many different actors and possibilities that share a core set of values but operate according to what's needed, what's in front of them, that person. In almost every case, we already have templates for these new forms of care. I'm talking about things that already exist. Shared lives, a growing national home share scheme providing support to young adults and older people, Buurtzorg, holistic-led nursing care, Somerset Carers, a platform that allows microcare to operate with people in a very relational way, the community circles that I started, and so on. And these new forms of care share an ethos that emphasises care as a relationship, giving autonomy to the carers and to those of us who at any particular moment in our lives need support. Creating this infrastructure requires new leadership, and in the United States, the holding company is a lab dedicated to designing how we care for each other. In 2020, they published their first Care 100 list, and I think it's really notable because of the breadth of people that it recognises, because it understands that we need a diversity of leaders, investors, practitioners, activists, scholars, if we're going to build a new system. And it requires new forms of policy making. The state has to set out a framework which sets out a goal and a design code at a very high level, which says what national flourishing is, and then allows human scale solutions to grow within that very big picture. So it's completely the opposite to an existing industrial command and control making policy process. It specifies parameters, metrics, regulation, and a culture in which our relationships to one another can grow. But of course, this in turn requires a new economic framework, which is my fifth point. We have to design a new care economy. So what about the money? Of course, this is what people always ask me. And I think one answer to this question is we just don't know, because our metrics are so limited. When we think about the care economy, sometimes we include the expenditure of those who pay for their own care, sometimes we don't. We rarely include the contribution of unpaid carers. We don't often include what people who have their own personal budgets choose, whether it's a visit to a hairdresser or to see friends. This doesn't tally with formal ideas of what care is. We pay care workers derisory sums, and we don't factor in the cost of churn, recruitment, agencies, the misery of those who are cared for, and the wider system costs dealing with the burnout and the mental stress of our carers and their families. And we accept a very inequitable distortion of resources, with funding always skewed away from communities and individuals towards inspection and regulation. With younger people and with old, we don't calculate what is the real cost of refusing to provide early the small and personal things. And lastly, we accept the scandalous leakage in untaxed profits made by private care providers. But I think the most important answer to this question about the money is that the question itself is too narrow. 21st century care has to be capitalised within a new economic framework, and this requires two shifts. So firstly, care needs to be categorised not as a cost, but as a core investment, as essential infrastructure, just as the vaccine makers recognised. In the US, we see very important moves towards this understanding, which is why I'm so happy that Anne-Marie Slaughter is here with us today. And in the UK, I think we have to recognise the centrality of care to local community and to any concept of levelling up and a green industrial strategy. And the second shift is closely related. The care economy will need a particular set of rules to flourish. Foundational principles have to include a definition in which time, skills and money can be brought together and blended in new ways. That we need a regulatory framework which doesn't distinguish between public and private providers, but privileges worker ownership models and makes absolutely illegal the extraction of profits. Surplus in this economy has to be reinvested back into the care economy itself. We need a culture which privileges learning over continuous audit, because we are all still at the beginning of this path and we don't really know all the ways it can grow. So I think the COVID-19 pandemic has been a cataclysm. It's brutally exposed the crisis in funding, culture and operation of our care systems. And I think that we can honour this recent experience and much deeper legacies of injustice by creating something new. As I've said, there are many examples of the forms of care I've been talking about. They're all around us. But what we're missing is the new framework that would enable these new things to attract resource and to grow within new regulation. And that would in turn allow us to thrive. But this can only happen when we dare to imagine, and when we recover what it actually means to care, when we rescue this most human activity from the industrial clutches of an outdated system, and together, I think all of us can create the new. So thank you.
Thank you, and thank you for rejoining us, and thank you to Hilary for that I found really inspiring talk. Now, we've got best part of 3/4 an hour now for some discussion, and we're going to begin with some responses from some people we have, some online, some in the studio, and there's a bit of time even for me to say something. I'm going to say very little because I want to get on to the conversation elsewhere. But Hilary, I think the thing I was most struck by, and which I think is particularly important, is it's terribly easy in this debate to think almost entirely about the experience of the people being cared for. And of course, their experience is unbelievably important and how that's managed. But part of what you were saying was, I think, a really clarion call to recognise that this is a relationship. And even where there is care being received, if there is care being received, there's got to be somebody doing the care. And so thinking much, much harder about all of those participating in this thing that ends up generating care. So that was one thing I took away from it very powerfully. The second thing that I was struck by as I listened was that we're still calling it care. And I even wonder whether that itself, care sounds like something that's done to somebody, or it's easy to think that care is something that we do to people. And it seems to me that much of the burden of your remarks is that's so much not the way we should be thinking about, even in cases where the need is very extreme. We need a context that is not something being done to somebody. So I even wonder about the word that we use for describing this incredibly important
and
relationship.
I know I'm not meant to come back in, but I just think to your first point, what's so important and beautiful is that you've described it as a relationship, because I also think so often we either kind of fight for people receiving care or we fight for the care workers as if it's some sort of another border war, when actually you just said it's a relationship. So just to say, I really like the way that you framed that. I think it's critical.
Thank you. Well. So that's more than enough for me now. So we've got 4 wonderful people who are going to give their initial responses to what Hilary said. Then there's scope, and I even have a machine. Although she's worrying, the machine is now blank. So I'm going to pass that to Kathy and ask Kathy to pass it to somebody who will come up and stop the machine being blank, so that I can see questions that are coming in from other people outside. So we'll get that going. But we're going to begin with Clinton Farquharson, who's joining us online. She's probably behind. Well, online I can see Clinton in front of me. Great to have Clinton here. I'm not going to go through long bios of all of our contributors because you've got them. But Clinton, chair at the moment of Think Local, Act Personal, Social Care Institute of Excellence, many other things. And also importantly, somebody who himself has experience of the care system, both on his own part and helping to look after his mother's personal budget. So Clinton, we're delighted to have you here with us, and let me pass over to you.
Good afternoon, everyone, and thanks, Hilary, for your diagnosis of what's wrong with so much of social care today and your insights on a new way. As someone who draws on care and support, and others like me, we experience many of the shortcomings you have identified. Commissioning by time and task, leading to rushed care, transactional procedures that deflect people away, and practice that too often sustains the gift model, doing to and not with. And for those of us who choose to take a direct payment, in many places, this is still far from straightforward, which deters many people. And for those who persist, they can be heavy restrictions on how budgets are used, and genuine choice and control. Key elements of personalisation are far from universal. And what I take from Hilary is that the system cannot be fixed, and we cannot simply lift the bonnet and replace a few broken parts. Okay, coming from Birmingham, I would say we need a new car, but I worry this will dent my environmental credibility. Let's stick with, we need some major rewiring. So how do we do this? Firstly, we need a vision to organise around. I like the vision that Social Care Futures, a growing social movement, has created. It says we all want to live in a place we call home, with people and things we love, in communities where we look out for one another, doing the things that matter to us. If we or someone we care about has a disability or health condition during our life, we might need some support to do the things that's the role of social care. When organised well, social care helps to weave that web of relationships that you mentioned and support in our local communities that we can draw on to live our lives. in the way that we want to, with meaning, purpose, and connection, whatever our age or stage of life. There are already places that are thinking about and organising social care differently to achieve this. For example, by supporting facilitators who bring families and friends and neighbours together to support someone to do what matters to them, strengthening the relationship of everyone involved. And me personally, I use a personal assistant employed by people to provide practical support, someone who can lead our own life our way, and organisations that connect people with opportunities to use their skills and talents, which improves their well-being and benefits the local community. We believe that this can and should be happening everywhere for everyone. For that to happen, the government must make good social care a priority and begin investing in it. And more local councils need to urgently start working alongside and supporting local people and organisations to bring these ideas to life by organising and investing in social care differently. This speaks vividly to me. A good supplement is the Making It Real, which was produced by Think Local at Personal. This describes what good personalised care and support looks like from the perspective of people who draw on care and support. It's based more on an equal, empowering relationship. This feels closer to Hilary's point on shifting from viewing people as rational, individualists, competing with each other, to seeing ourselves through the lens of relationships, connections with each other. Secondly, we need to reimagine social care through co-production with people who draw on care and support. I believe it is essential for people like me to be listened to and be able to influence policy. We must create space for our voices to be heard, to enable people who need support to be able to live their best lives. And thirdly, a bigger, bolder and braver ambition for social care must address inequalities, both in relation to people drawing on care and support, including those missing out and people who provide support, paid or not, regulated and unregulated. What interests me is the relationship between social identities such as race, gender, disability, age, etc., and how they overlap and interact with each other to affect people's experiences and outcomes. That's intersectionality to me, and it's all that who I am. There's no such thing as a single issue struggle, because we do not live single issue lives. This is difficult stuff, but we do need to address these issues. So my thanks to Hilary for providing us with such a stimulating account of how we have got to where we are now, and for those big signposts that point to social care system that is fairer, more inclusive, relationship-based, and above all, more human. Thank you for listening.
Thank you very much, Clinton. It's great to have you here with us, albeit virtually. Now let me turn to Anne-Marie Slaughter. Anne-Marie, who's joining us from Princeton. Anne-Marie, who's been engaged in a wide range of policy and academic discussions around these sorts of issues for some considerable time. And it's great, Anne-Marie, to have you with us, another benefit of the virtual world. I turn to you.
It is so great to be able to be here And I have to just start by saying how glad I am that this lecture is now out in the world. Even yesterday, I was emailing Hilary and saying, can I send it to people? Can I send it to people before you give the lecture? This work is so important. And I'm going to talk a little bit about what's happening in the United States, but also what's not happening and why this larger framework is so critical. We have seen an amazing shift to a focus on care. I wrote a book in 2015 and talked about the path to gender equality meant that we had to value traditional women's work of care as much as traditional men's work of breadwinning. At that point, you had a group of feminist economists who'd been working on care issues for a long time, and indeed Betty Friedan's second book talked about care. You had people like Ai-jen Poo as an activist for care workers who had been talking about an infrastructure of care. And you had separate interest groups like the Association of Retired People pushing for elder care, and family-based groups pushing for child care, disability activists. That was 6 years ago. Now, the idea of the care economy, of an infrastructure of care, of a care agenda is on the agenda. President Biden has pushed his care agenda, informed by all these groups, both when he was campaigning and, of course, at this very moment. His infrastructure bill, his social infrastructure bill, has many of the components for community and home-based care, for child care, that we need. It does not have paid family leave. I'll leave that aside, but care is on the agenda, which is very, very important and new. And I would not give up the word care just yet because we've finally gotten it on the agenda. So that, now we come together with this understanding that we have to bring all these different pieces together, still largely driven by feminism, right? That this is the way you keep women in the economy. And so particularly after the pandemic, if you looked at the New York Times yesterday, there's an article about why paid family leave is important. It's almost entirely described in feminist terms and, more importantly, economic terms, that we need women in the economy because we need to keep growing. That is antithetical to the framework that Hilary has laid out. So we are making progress, but let me now turn to what I think Hilary brings to this debate. We have not made that larger turn to the understanding that care also connects to the environment, as Hilary said, to connecting to the earth. Kate Rayworth's work on donut economics, the idea that we need enough to care for each other, but it has to be sustainable to the earth. Nor has anybody really connected the focus on care to the passing of the industrial age. As Hilary says, drawing on Carlotta Perez's work, really thinking through technological revolutions and how they change how we live. That is also not something we've thought about. And really, as Clinton said also, although people talk about the digital age and personalized products all the time, you can get running shoes personalized. We haven't talked nearly enough about personalized care, a little in the personalized healthcare area, but not more broadly, to this focus on moving past the industrial assembly line, not just metaphor, but systems, to changing new systems. And I want to then say what you are seeing, you're seeing green shoots of this larger turn, to understanding care as the basis of human flourishing and thriving, which is really at the heart of Hilary's lecture, that care is a relationship. It is a relationship that benefits both sides. More than benefits both sides, it's the relationship that enables us to rise as individuals, that we are individuals, but we are also in relationship with others. That's this idea of sapiens integra, that we are whole people. Let me close by saying where I do see positive signs in the United States, and I know the British scene less well, although I'm trying to follow it. So you do see a discussion of how can we better measure human thriving and connection. You have the Social Progress Index. You have actually the Biden administration interested in what other measures could we add to unemployment and GDP, which GDP, of course, is only about growth. And so much of this work will not be about growth. It will be about repair and sustainability. You find a focus on family economic security. One way that you can measure care is to think about what strengthens the whole family. And that is everything from the child tax credit to the earned income tax credit to things like paid family leave, child care, support for home-based care. And finally, to this point of care as a relationship, Hilary and I published a piece in The Atlantic that started with the premise that care is not a good or service. Our economic categories are goods and services are done to people, for people. The core here, as Clinton says, this is with, this is not for. So it's not the helping economy, it's the relationship economy. And there, and Clinton touched on this, you are seeing the rise of coaching and guiding and advising and assisting and mentoring. All of these are what you might think of as care plus jobs, teaching as well. They are all relationship based, and they are all based on a mutuality of human connection that empowers and enables both people, both parties to the relationship, and makes them both greater and our society and communities stronger when we can see our fundamental identity as humans as being, at least in part, in connection with one another. So I'll stop there, but I have to again just say this is extraordinary work and could not be more important for our time.
Anne-Marie, thank you, and thank you so much for being with us. Let me turn now to Will Tanner. Will, who now is director of an organisation called Onward, a policy think tank, but has been engaged in policy advice, including in areas that have been close to this. Will.
Thank you very much, Andrew, and thank you very much for having me here today. It was a great privilege to be able to sit and listen to Hilary's lecture, which I agree entirely with Anne-Marie is incredibly timely. And I want to pick up on one particular aspect of what you said, Hilary, in a moment. But before I do that, I just want to touch on why I think this is particularly of the moment. So 2 years ago, we published a big report ahead of the last general election in this country, where we tried to investigate what was the kind of underlying motivating force of our politics. And we asked a question, a large sample survey, that asked people whether or not they wanted to live in a country where the government focused on giving people more freedom, or whether they wanted to live in a country where the government focused on giving people more security. And we asked this because we had an inkling that people were turning away from the kind of the post-war liberalism that we've seen for the last 4 decades. If you think of Roy Jenkins through to Margaret Thatcher and the kind of economic liberalism of the 80s through to the social liberalisation of Tony Blair's kind of era. And what we found completely blew us away. We found that 2/3 of people wanted a government that focused on security, versus 1/3 of people, 35%, who wanted a government that focused on giving people more freedom. And we articulated this as a kind of Jim Callaghan style sea change in our politics, a kind of movement away from an era of freedom towards one of security. And I think there are lots of implications for that shift. And I think it's borne out by lots of other data too. Other people have, I think, substantiated some of those claims. But I think it's very relevant to this discussion. And I think it's very relevant in one particular degree. So you talked about time becoming as commonplace, time for care being as commonplace as the weekend. And I think a big motivating driver between some of the disruptive politics that we've seen in recent years, and actually lots of the kind of disgruntlement and unease that sits within voters and families and communities up and down the country, that the government's trying to speak to with the levelling up agenda and some of the policy initiatives today, come down to time insecurity. And this, I think, is a kind of fascinating and largely kind of observed or researched aspect of our kind of current political economy in this country. It's very relevant to care, but it's relevant across lots of other domains too. And the reality is, actually, if you look at the time dedicated to care, time to care is becoming normalised to a much greater degree. So if you compare today to the 1970s, women spend twice as much time on childcare today as they did 40 or 50 years ago. Men spend inordinately more time on childcare, but that's because of the low baseline from the 1970s. There's been a significant increase in the amount of time spent on care for on kind of adult social care, care for elderly or kind of adult relatives. And I think it's true today that a woman reaching the age of 50 is likely to spend 5.9 years on adult social care in their remaining time alive, 4.9 for men. So we have had a significant shift towards time to care. But I think, and this is I think what you were speaking to, Hilary, that shift in time has been actually not particularly orderly in any way, and it hasn't been focused on relationships. It's been increasingly people caring around work, alongside other commitments. We've seen a retreat into more kind of smaller kind of families and people moving away from the communities in which they grew up. So care has become more kind of atomized and distanced as well. And so I kind of really welcome your focus on unleashing or unlocking time to care. But I think we also need to think very carefully about the culture and the nature of that time and how we use that time. Because it seems to me that while there is more time in volume terms, that time may be poorer today than it perhaps has been in previous decades, in a world where communities were closer, families were more, were kind of deeper in their relationships, perhaps, where there was a stronger kind of ecosystem around care. And then I think we also just need to reimagine the institutions that provide our care. I think your point about the death of the care home was provocative, but incredibly well made. I think the way in which we structure and organise our care is not built around relationships. It's largely built around kind of placing people out of sight, as you mentioned, and doing that in a way that fits with people's time commitments today, I think is incredibly important.
Will, thank you very much. And now finally, let me turn to Kathy. So Kathy Williams, who is the Chief Executive of ADAS, the Association of Directors of Adult Social Services, and before playing that kind of representative and managerial role, was actually involved in social work, in social care herself. So Kathy, over to you.
So thank you and bravo, Hilary. It's great to hear that. First of all, I want to pay tribute and recognition to people's experiences during the early stages of the pandemic, to those older and disabled and mentally ill people who were isolated and locked down on their own, to family carers who had no support and kept going 24 hours a day, 7 days a week for months on end, and to the care staff who were incredibly courageous, compassionate, and committed to keep going without PPE, without the protections, because social care was an afterthought to healthcare. Secondly, I want to reflect that not all of us are easy to help or find it easy to ask for help, and not all relationships are the ones that our best friends would think were good for us. And it's been particularly difficult for people living in cramped, close quarters with abusive partners. And it's made it specifically very difficult for women. And I was very caught by the UN Women's Committee early on in the pandemic saying that actually women's income decreased, their caring responsibilities increased, and violence to women increased as well during lockdowns. Secondly, social care is there for all of us, for those that families find easier and less easy to include, and that communities find easier and less easier to include. So if I've been hoarding for years and my neighbours want to complain about me, I'm more difficult to help and need particularly skilled social work to engage with and to engage with communities. And social work, of course, is there for everybody. And support for individuals and communities need to be there for everybody. One of the things that we found from responses from our members when lockdown started to ease was that there was a significant increase, unsurprisingly, in people asking for help for mental ill health, for domestic abuse and safeguarding, and for carers who had got to the point of breaking down because they couldn't cope anymore and hadn't had any break or support. We also found that over the last 6 months, social carers increased the amount of care that's provided and organised in people's homes. And we've also finding that the occupancy rate of care homes has gone down significantly, partly because more space is needed for people to socially distance, but partly because people are more fearful of a closed environment. And there's certainly absolutely no doubt a place for care homes that are homely places in communities for people who choose to live with others. But I think that if it weren't a case of economies of scales, we wouldn't be thinking about 120 place nursing homes for older people. We'd be thinking of very different models. I do want to say something about working in care, because for me personally, it's outrageous that care work is paid less than turkey plucking, burger flipping, or shelf stacking. These are people who are caring for us, for our families, for our siblings, for our disabled children, and the work is enormously skilled. I also think it's shameful that care staff is described as unskilled in relation to immigration purposes. So how to make it work? I think there's a lot about the imagination and the conception of this that's incredibly important. But I think it needs support and decisions within families as to how they organise their working and their caring lives, within communities, because some communities are inclusive and supportive, and others can make you just feel awful because you don't fit in. But there is an awful lot of goodwill in communities. I think we really do need to also recognise the contribution that disabled and older people and mentally ill people can make, and even people at the very end of their lives holding the hand of somebody they care about and who they empathise with the loss of. Disabled and older people can make significant economic contributions and very often aren't given the opportunity to do so. And finally, there's a role for employers and for governments, because the kind of benefits, allowances that we've fought for and built on in relation to caring for children should be, in our view, extended to caring for parents, siblings, and others. So things like rights to paid leave, sabbaticals, and even more flexible working. And when I say flexible working, I don't mean the flexibility to work 70 hours a week whenever you want to. So thank you, Hilary. It's a great question to be asking about, can we care for care?
Thanks, Kathy. Hilary, we've had 4 bits of input there. Is there anything you'd like to say, having heard that, or do you want us to move on to other questions from the audience and we can try and read it together? But you should have a chance to.
No, I don't think so. I mean, I'm incredibly great. I feel people have sort of built, all of you have built so beautifully on what I said, and I've just been taking notes, really. No, let's have a discussion. I think I held the microphone for a long time. So
well, you're very kind. So we've had lots of people, both in advance and while we've been on air, sending questions in, more than 100, so many more than we can possibly cover now. But there are a few areas that I thought it might be interesting to pick up on. One that comes up again and again is whether or not getting some kind of new approach means we have to rely on central government to embrace some new ideas and take action, or whether this is something that can be done at a more distributed level, whether what we all as individuals do and say and believe can be part of this, whether there are intermediate institutions that might be social entrepreneurs, cities, whether we can make progress without having to wait for the whole of society to come together through central government action. And I am tempted, Hilary, to start with you there, because I think one of the things that we're looking to you for is some wisdom on that.
Yeah, so I mean, I think this is an absolutely critical and very difficult question. And I mean, I think we can't move forward without the state is the bottom line. I think I'm very interested, as I said, in technology revolutions, and Anne-Marie referenced the work of Carlota Perez, who is an extraordinary economist who studies these and sees patterns over time. And what we see is that when big social systems need to move, we do need everybody. You know, we need people with big ideas, we need organised civil society, we need business, and we need the state. But the state has to be the prime mover, because the reality is that until the state, I mean, you know, I liken the state as the head gardener in my book, Radical Help. Unless the state sets out the architecture, we're all a bit stuck. So, you know, the state has to say, we're going in this direction, we're going to value these things. And then, of course, as I say, the answers have to be micro. I mean, Somerset Carers would be a really good example, that they're kind of very small cooperatives, but they can only function because in that locality, money has been allowed to flow in that way. And so I think at the moment we have this problem that we have this very industrial state that, you know, and this is not a party political point at all, you know, it doesn't really matter who's in power, is that they don't know how to set out this framework and then allow other people to take things forward. But you know, we have got the money is frozen in the wrong places, that is resource, and we need to set out a different framework.
We're running low on time, so I'm going to come to our four contributors and give them a very, very short moment to respond on that particular set of issues. And then there's one other question that's come up again and again from people listening and in advance, which is, are there good stories out there? And in a sense, Kathy has already touched on this, but are there good stories that we should celebrate? And my own sense is there are, and that one of the extraordinary things about this is, despite all of the challenges, many of the people working in this sector are doing fantastic work, and work that's enormously appreciated. So I'm going to come to each of the four of you, and I'm going to come in a different order to the order we came in first time around. It's really thoughts, very, very brief, less than a minute if possible, thoughts on either are there good stories and how can we celebrate them more, or what should we think about the role of the state in all of this. And I'll come first, if I can, to Anne-Marie. Anne-Marie.
I just want to build on Hilary's point there, that the idea that the state has to provide the framework, and it maybe particularly works in a federal system, but this is, again, where, as much as we may not want it, the state measures things. The state, and of course politicians, are then reelected based on to what extent they've succeeded. And it's why it is so vitally important that the government decide, here is what we're going to value, as Hilary said, but here's also what we're new measures of human thriving, of as I said, family economic security, and then get out of the way to allow a vast array of experimentation.
Yeah.
Very good. Thanks, Anne-Marie. I'm going to come to Kathy next, then Clinton, and then Will. Kathy.
Yes, I mean, absolutely. The economics of it has to be shaped by the state. It's shared with families and with businesses, but it has to be shaped by the state. And the issues about who bears the risks in terms of funding this are phenomenally important. At the moment, people who are working in social work and in local authorities are in places they never wanted to be in terms of rationing care and support, and making invidious decisions between how many people get care and the quality and rates that are paid for it. And certainly engagement in communities and with individuals is essential within it, but that underpinning needs to be there too.
Thanks, Kathy. Clinton.
I just think that there are stories of success out there. Hilary's mentioned them. I mentioned some, but those stories of strength, of love, and joy and revolution as part of our history that has come out of the pandemic, and it needs the government, because it's not either or. It does need the government to create those conditions for which Hilary talked about. It's time to thrive.
Thanks, Fenton. Will?
So I think the question about the state is a really interesting one. I broadly agree with Hilary that the state kind of sets the parameters, but I think we are talking about asking the state to do or play a fundamentally different role to the one it currently provides. And I wouldn't underestimate the scale of that challenge and actually what that means. I mean, in some ways, you're asking the state to remove itself from some bits of the system and to empower communities, families, local institutions to take on a greater independent and distributed role. And so some of that will be enabled by the state getting out of the way and extracting itself from the kind of managing the minutiae of care and creating much more empowering frameworks for funding and standards and kind of the nature of care, which will require the state to kind of retreat in some respects. So firstly, I don't think it's a matter of the state or not. I think it's a different and kind of another role for the state. Just on the nature of success, I mean, I'm also a historian like Hilary, and near where I live in East London, there is a wonderful set of almshouses on the Whitechapel Road, and there are a number of very interesting new modern almshouse models around the country. And I do wonder whether or not we should be thinking about drawing on our history in terms of civic provision for some elements of social care in this debate, and kind of creating more kind of local civic models in this space that perhaps don't rely on the state as much, perhaps as others.
But can I say, just for clarification, I think that only the state can provide the framework for that to happen.
Yes.
That's what I'm saying.
Yes.
I'm not saying that the state is going to provide everything, but the state has to draw up the rules of the game. And I suppose also as a historian, I mean, my parallel would be the design of the National Health Service. I mean, Beveridge said, or not actually Beveridge, but, through the Beveridge plans, there was the idea that health is going to look like this. You can only draw down money if you play like this, and you do you have these new measures like this. And you can exit the stage if you don't want to do that. And of course, that as we know, doctors came in kicking and screaming. They didn't actually want to enter. Unfortunately, some really good things were lost, which I also write about. I mean, these processes are not always easy. But then all sorts of new things come in because it's very, very clear about, what the direction of travel is. And there's so much energy, so many stories. But everybody is sort of trying to roll a rock at the moment in the ways that I think, Clinton talked so powerfully about. And that can't happen till the parameters are changed, I think.
Wonderful. Well, that's a very. We've got 2 minutes before we turn it all turn into pumpkins. That seems an appropriate type thing. So we should stop at that point. Hilary, thank you, and thank you not just to Hilary for her wonderful lecture, to everybody who's contributed, but also to people who organised this event.
Thank you very
it's
much.
Great to have stood back far enough to recognise that, as well as much of the kind of work that the Health Foundation and the Real Centre does day to day, which is looking really very hard at the practicalities, at the economics, at what's happening. We do need to stand back and think, what are we trying to do here? What's the point? What's the object? And that's been really stimulating. Things that are coming up. Well, this has been recorded, so thank you to those who've been here, and also thank you to those who've been watching. But for those who thought it was actually just the most exciting thing you've done in the last few days, within about 24 hours, you'll be able to show it to your friends. You'll be able to send them the link, and they too will be able to delight in thinking very hard about what we're trying to do here. A few things that are coming up from the Real Centre. There's a report on international comparisons of nursing pay coming out later this month. A report on social care need the following month, which is clearly critical in all of this. And then we've got much more work coming up in 2022 on the NHS health and care workforce at the heart of getting all of this done. So thank you for everybody who's been here. Thank you to those of you who've been online. Stay well and come back next year. There'll be another annual lecture next year, and the bar's just been set very, very high indeed. Thanks. Bye-bye.